Welcome back to This Day Live, the Sunday talk show here on the Arise News Channel. With me today I have Professor David Awurawo, Professor of International Relations and Strategic Studies at the University of Lagos, Nigeria, and Okpeyemi Adamolekun, Executive Director in our office in Off. Now it's April 7, another major milestone today, and another landmark for global health authorities to pause and evaluate how much progress has been made in the effort to provide basic health care to the world's 8 billion inhabitants. According to the World Health Organization, the theme of this year's commemoration, My Health, My Right, was chosen to champion the right of everyone, everywhere, to have access to quality health services, education, and information, as well as safe drinking water, clean air, good nutrition, quality housing, decent working and environmental conditions, and freedom from discrimination. For us here in Nigeria, a litany of questions arise every time the issue of rights is brought into conversation. And funding for the health sector is, to say the least, still abysmally low. So, which way forward? Dr. Godwin Maduka is a United States Nigerian medical doctor, businessman, and philanthropist. Dr. Maduka is the founder of Las Vegas Pain Institute and Medical Health Center. And he joins me now to look at the message of this World Earth Day. Good day, Doctor, and thank you for joining me on This Day Live.
Thank you very much for having me.
Okay, Doctor, the whole issue about World Earth Day 2024 is based on rights, constitutional rights. Section 42 of the 1999 Constitution of Nigeria talks about non-discrimination when it comes to rights. The National Health Act, also of 2024, defends the right of the average Nigerian to have access to quality health care. But this is a major problem in Nigeria today. People don't have access to quality health care. They need to even spend money out of pocket allowance to be able to have access. Now, you have been abroad. You know what happens elsewhere. What are those missing lines, those omission points in Nigeria's approach to healthcare?
Oh, I'm trying to quite understand you, but you asked me about the situation of healthcare here in Nigeria as compared to the US. Is that what you're saying?
Yes. And what lessons can we learn? What do we need to do to help our people?
Okay, thank you. We have a healthcare crisis here in Nigeria. As you know, I trained in US. I'm a pharmacist and also a medical doctor. I trained in anesthesia and surgery, and I operate about 6 hospitals in US. I also built one here in Nigeria, so I can actually tell you what the problem is. We know about the brain drain of the medical doctors from Nigeria, and we don't have enough doctors now for the amount of people that we have here. And we also believe that the training of the doctors here have to improve, which is one of the reasons some of us that have been in US and also have some kind of interest in Nigerian healthcare. I'm just going to go straight to what we need to do, which is we need to improve our level of training. We need to give doctors enough incentive to stay here. and that will improve. Yesterday we have unveiled transatlantic University of Medicine and Healthcare Sciences here in Anambra State, and the idea will be to give them the kind of training that we get here in Nigeria as well as abroad. And from there, we'll give them also the postgraduate training that will make them to stay here instead of seeking training abroad. And then after that, we'll make sure that doctors are paid well and given enough incentive to stay here, so that our patients don't have to be going to India, America, UK to get the treatment they need.
Ask you about the role of Nigerian doctors in diaspora specifically. Because one of the issues we have had is this phenomenon called Japa phenomenon, whereby Nigerian doctors are going abroad and they are leaving the country. You have given, there are things we can do in the country, but can anybody stop this Japa syndrome? What do you think?
Yeah, I mean, it's like I said earlier, they're going abroad for better pastures, and also going to abroad for training. So to retain them here, we have to make sure they're well trained here so they can compete with anybody anywhere in the world. Again, they also have to be paid well as their counterparts in the rest of the world. So I don't see why anybody will leave this shore to go to overseas where they are foreigners. If they're making the same amount of money they get here in Nigeria, or if they're being trained adequately. Check the number of neurosurgeons, for example, that you have in Nigeria compared to the population. You will realize that there's a problem. It's somebody who have a brain trauma might have to be airlifted to overseas to be trained, to be operated on. You don't expect them to be here. There might not be enough neurosurgeon to do that. Okay, so Nigeria need to invest, both the federal as well as the individuals in this country need to invest in healthcare. And I think we have enough resources to do that. That starts from the training the doctors and paying them well after training. And they will only go overseas for vacation. They won't be living. So the answer to this brain drain or moving away from Nigeria is for better training as well as getting better reimbursement for their services.
Okay.
I don't think it takes anybody else to do to think hard about that.
Well, Doctor, I get your point about this training, providing infrastructure, trying to prevent people from leaving the country. We have basic problems in Nigeria: smallpox, tuberculosis, chickenpox, polio, and leprosy, and the one that is growing now, prostate cancer, all varieties of cancer, breast cancer. What do you think we can do in-house here in Nigeria to address those issues? Because these are big public health issues. How do we strengthen the public health system in Nigeria? Not textbook, not theory, practical things based on your own experience.
First of all, most of these diseases you mentioned, we do have it abroad where I live. But the amount of doctors, for example, in US, they're producing is probably 7 to 10 times the amount you produce here per 1,000, for example, 100,000 patients. I think, as simple as it might sound, that we in some part of Nigeria, you have about 200 students vying for one spot in medical school. For the past 20 years, I decided to build a very good medical school and allied sciences, health sciences. So you have people that will be in research, people will be trained in fellowship in all these diseases that you mentioned, and they will be able to handle that. So we need to invest in the training of our doctors. We need to invest in building more medical schools. We need to invest in research, both in tropical diseases and other kind of diseases you mentioned. Okay, it's not really that hard to do if we pay attention to this, both from individuals and from the government. I'm trying myself here, I'm trying to see what I can do in this part of Nigeria, in Anambra State. Like I said, I trained I went to school and became a doctor in pharmacy. Went to school, became a doctor in medicine in US. End up training in anesthesia, surgery, and critical care at Harvard in Boston. And ended up building 6 hospitals over there where we take care of these patients. I came back about maybe 10, 15 years ago and built a hospital here in Anambra State where they doing the much they can. But I found out that we needed to produce more doctors and keep them here. If produce more doctors, some of them will go into research, some will go into surgery, infectious diseases, critical care, trauma. So we have a serious problem in healthcare in Nigeria. And that stems from the fact that most of our doctors are leaving and we're not producing enough doctors in this first place. So if we can provide adequate training, postgraduate training, residency training, fellowship training, and then they're also paid well, I don't see why they will leave the shores of Nigeria. There's nothing wrong with this country. We just to pay attention to some of those things that will keep our doctors here. Otherwise, we're going to keep going abroad for healthcare. We're going to be lacking behind in some of these areas you mentioned.
Well, Dr. Maduka, as I begin to wrap up now and we move on, I would like to ask you, the theme for today's World Health Day is My Health, My Right. What advice do you have for the ordinary people who must have been listening to you and watching you?
Today, World Health Day, medicine is my passion, and for individuals out there, a healthy body is a healthy mind. It's always go to your doctors regularly, or go to your community health center regularly, or to the clinic, check the basic labs, and your vital signs, blood pressures, and things like that. And you stay healthy. So that if something happened to you, or if you come down with some ailment or the other, it will be caught up in time. In time, they will catch it, so that it will be treated in time before it becomes so serious. So my best advice for the people is to always go to your doctor and get a regular checkup.
Well, thank you very much, Dr. Godwin Maduka, for joining us on this Day Live, this Sunday talk show.